is Ida Rachel Mensah from Ghana. The person sitting by me is my uncle. 2019, he was facing some challenges, swelling of the feet, vomiting, and others. So we consulted a doctor in Ghana, and they found out that he has a kidney problem, end-stage kidney. So they advised that we do a kidney transplantation. So upon their advice, we organized ourselves and came to India, Kolkata to be specific, R N Tagore Hospital, to see Dr. D.S. Roy. Upon our arrival, that was in October 2019, they started looking after him, but there was a lot of complications and other things which they had to do one after the other before they could do the main surgery in 9th November, that is 2020. So we have spent almost a year and over here, but now by the grace of God, he is very fine. In fact, I was very scared because they told me that he can, when they don't do it, he might lose his life, and when they do it too, it's a very higher risk surgery. So in fact, I was afraid, but with God all things are possible. So everything has been done now. He is okay, and we are planning to go next week back to our country, Ghana. I thank God for his life and how far he has brought us. Amen.
Hello, this is a story of our Ghana patient, Mr. Isaac Kofie, Isaac Nana Kofie to be exact. And he came around a year back before this pandemic started for transplantation. He was very sick when he came. He had a cerebrovascular accident, he had hemiplegia, not able to walk, he was kind of wheelchair bound, and he was under dialyzed. So we put him on dialysis. We planned transplantation because that gives the best quality of life. And then he had one after another problems. Besides the CVA, he developed pleural effusion or fluid in the lung. Repeatedly we had to take it out. In fact, he had fibrosis in the pleura, so pleura we had to treat it. He developed gallbladder stone. He had gallbladder stone, so we had to operate it. And then he had developed pneumonia and sepsis. He was very critical, very sick. He was in intensive care unit requiring aggressive treatment, and finally he improved from that. Then in the meantime, when we planned for transplant, his donor, his relative Prince, developed COVID infection, and so we had to wait 4 weeks as per our protocol. And we have had by that time experience in dealing with the COVID infection and post-COVID transplantation. And after, when the donor recovered from COVID infection and we planned transplantation, we found Isaac to be febrile. He had fever, he had infection, and we found he had an abscess in the liver. So we had to drain it, treat it with antibiotic. Then finally he recovered. Even though he was very sick, we thought that's the best chance, that's the gap which we should utilize, and we did the transplantation on 9th of November. And lo and behold, he is so fine. He has improved from the from the kidney problem. He is up and about. He is very happy. His family is very happy, and this gives to all of us, the whole Narayana Health, R N Tagore Hospital, a happy news, something to be proud of. Thank you.